Thank you everyone for joining. People are starting to join now, which is great. We'll start in about 90 seconds or so. Give people time to get on and get acclimated. Thank you very much for being early. Everything looks good. Sound levels all look great, so perfect. Again, thank you everyone for being a few minutes early. We'll start in about a minute. Give everybody time to get acclimated. Thank you everybody for joining today. We'll join in here in a few minutes, start in about 30 seconds. Thank you. People are joining now, so we'll give them time to get in, get set up. We have a couple more joining here, and then we'll go ahead and begin. Appreciate everybody being early and on time. Thank you. All right, we're going to go ahead and start. Again, thank you very much for joining us today for this webinar, Optimizing CCM and RPM for Athena customers with ChronicCareIQ. I'm Justin Barnes. I'm going to host this session today, answer any questions that you have. There is a questions field in the chat field, so feel free to put any Q&A in there. The questions and answers is probably the best area to put that. We'll get to them towards the end of the webinar, but you're more than willing to put any questions if you want. We'll get to them as soon as we can. All of these slides, as well as the video, will be shared with everybody. We've also put together an ebook from this presentation as well, which is fairly easily consumable. So we'll share that with you as well as a best practices page that CCIQ has created just for Athena customers, and that'll all be shared with everybody after this webinar. So thanks again. Again, I'm Justin Barnes. I'll be hosting today. And we have Fahad Salim, who's also speaking today, who's the Chief Operating Officer for CCIQ. We'll be going through a lot of the best practices. He works on a daily basis with Athena customers with great success, and he'll be sharing some of the best practices, the key strategies. And then also CEO Matt Ethington, co-founder and founder of the company of CCIQ, his brainchild, and he'll be bringing together really the aspects of how the company started and also best practices, a little bit with the platform, but more with the overall opportunity. But then also, I'll kick it off right now with a little bit of a high level on what you can expect, not only from today's presentation, but regarding chronic care management, value-based care in general, and successfully navigating the future of healthcare. I've been fortunate enough to be in the industry for about 25 years now. Spent a lot of time on the innovation side, strategy side, public policy side of healthcare. Co-founded the think tank and a couple other fun companies in the industry, but I spent a lot of time also helping shape policy that's not only fair for where we're going as a country and fair for the government, but also fair for patients, and really looking out for patients in this process to make sure they're getting the best technology that's consumable, easy to use, and ready to hopefully stem the rate of healthcare costs that have been growing. I don't think you've been the cost curve down in healthcare, but if we could just stem the rate of healthcare growth and their costs, that would be a great win for everybody, because we're growing right now at about anywhere from 12 to 14% a year. So it's a little bit out of control, passing $4 trillion annually on healthcare costs. So we really just got to stem the rate of healthcare cost growth, and we can, make a dent in what we're doing. So specifically, I want to talk about, and I appreciate you guys being here for this conversation. This is a little bit of thought leadership series that I've created over the last couple of months and be going partly for the next year, but really taking the time to explain why chronic care management and deploying these type of strategies are so important for how you're providing care today and where you're going. Really, very simply, if you embark on chronic care management today and understand how the programs are applicable to you and your care strategy for you and your practice, for you and your patients, that is the essential foundation for where value-based care is going, where all the entire healthcare payment processes are going, healthcare strategy is going in America, but also, globally, but very importantly here in America. So if you're taking the time to learn what CCM is, what RPM and how you can promote those types of models and programs and care strategies inside your organization, inside your own care strategy, then that'll make a foundational difference for you as a practice. It'll make a great difference for your patients. And I'll talk about some of those metrics as well here in a moment. But importantly, navigating chronic care management is the essential glide path and foundation for where value-based care is going, where the future of healthcare is going. Every major program in healthcare is moving in this direction. So I want to congratulate everybody who's taken the time to join us today. Many of you have already embarked on this journey. Some are even, chronic care customers today, which is terrific. Many of you are looking at Chronic Care IQ as a company, but also, exploring how can this work within your practice? How can this work within your specialty? How can this work within your care strategy? So thank you very much. Again, all this information will be shared back with everybody later on today. We've created a webinar series, but then also an ebook that we will share with a lot of these highlights. Very simply, to give you kind of a all going, there's more money every single day being invested in chronic care management. The ROI is tremendous to the government, who is the largest payer in this. It's tremendously advantageous for providers because not only do they, all shows everything that points to the better care that can be provided, the additional revenue that's being invested here, again, by the private payers, but mostly by CMS at this point, but many, many dozens and dozens of private payers are rolling out reimbursement models for chronic care management. So it's very exciting to see that. But there's more money every single day being invested in this from the administration, from Congress, from the White House, all these programs, executive orders coming out on value-based care, on virtual care, how we can begin, extending the care outside the walls of the practice, how we really can manage care in between visits for the patient, how we can keep patients out of the hospital in better environments, safer environments. So all of these models are being created and fortified every single day. And you're going to see more and more in the coming years. Also, very important, by navigating these models today, even at a small scale, you can really stave off the cuts that have been implemented by CMS. We had a 3.4% fee-for-service cut this year in 2024, and we have more cuts slated every single year moving forward. Now, they're not as drastic. They're around less than 1% or 1% or so in the future years, but that's still, no one wants their pay cut. No one wants reimbursements reduced. So a great augmentation to that would be to deploy CCM, chronic care management type programs and these models inside your customer base. It doesn't have to be with all patients, but you can really look to see how it can fit into your model, how many patients. It might be 50, might be 100, might be 200, might be 300, maybe 1,000, maybe 2,000 patients. You start getting up there, you're creeping into significant dollars. But even, you put 100 to 200 patients a month on these programs, there's significant dollars. You're going to hear a lot about that coming up with Fahad and with Matt. But real quickly, by some of the numbers to show the success that these models bring to your patient base, very high, consumable rates by patients and success rates, but 94% of respondents of the RPM program have improved outcomes. Those are the doctors saying that specifically, the care providers saying that specifically. 73% of these providers said that they yielded a net positive return. And that's one of the reasons why I partnered with CCIQ, and I'm very passionate about the company, is because every single practice that I've spoken with, every single care provider within their customer base have had significant financial improvements, significant care quality improvements, but also financial improvements. And both I feel are very important. We always want to focus on the care aspect of healthcare, which is wonderful. That's why we're in healthcare. However, having the financial mechanisms behind that are critically important as well. So it's great to see what they've been doing. And 78% said that CCM ROI comes from additional revenue. So they respect the care side and what it can do for patient enablement and engagement and satisfaction, but there's significant revenue there as well, which we must be respected. So a lot of opportunity there, again, on the patient care side, patient satisfaction side, and the financial side. And with that, I'll turn it over to Matt Ethington, who will dive more into that. Welcome, Matt.
Yes, and thank you, Justin. Hi, everyone. I think probably the most important thing that I want you to know about me is that I am a chronic patient. And I built this platform because about 24 years ago, I got very sick. I was diagnosed with type 1 diabetes in the emergency room at the age of 30. And this is after losing weight, being incredibly thirsty. Then my body started cramping. I didn't really realize how bad a shape I was in until I got kind of to the emergency room. And I found out that my life was about to change in a lot of dramatic ways. So at the age of 30, I learned that I had to give myself shots and I had to poke holes in my fingers and test my blood sugar. And the big thing behind that was it was a chronic disease. It is a chronic disease that requires a massive amount of attention. And thank goodness that it does, right? Because you can have a relatively normal life if you do the right things. And the reason I bring that up because it's so important is that it requires management. And the reason that chronic diseases are essentially the at at the center of value-based care is because when they're not managed, they get worse and worse and worse and worse. Obviously, not all of them as quickly as type 1 diabetes can go bad, and as things like heart failure can go bad, but it requires management. And at the time, I hadn't really been involved with medicine. I mean, I hadn't been to a doctor since I had a physical. I was on the swim team, so in high school. So I just thought it was really difficult to interface with medicine. I had a concern that I had a lot of anxiety about. I left the hospital with 2 prescriptions and a pep talk, and the instructions to go find a doctor. And when I gave myself my first shot, I was with somebody on the phone from the American Diabetes Association that had walked me through practicing on an orange first. So the point is that when you have to manage something like our seniors do, our Medicare age patients do, and they have 2 or more chronic diseases, and they want to try to keep it in balance, there's a lot of anxiety, there's a lot of worry, it takes a lot of work. So much for me that I decided to change my career at that point and go into medicine. I was in database technologies, and I went directly into what then was an emerging space called electronic medical records. I accelerated into that space, ultimately created a company and exited an electronic medical record that managed 45 million electronic medical records for doctors on 2 continents. So I have been the patient for a long time. I've been inside of small practices. I've been around technology. I know the pressures. I know how difficult it is to adopt things. And the reason I'm involved in this is for patient care. I saw a way to do it differently, and it's by engaging patients. Healthcare might be one of the only industries where we don't really have a constant open door for our customers, and our customers don't really have the specific knowledge to tell doctors exactly what they need to be treated. So that's the purpose of Chronic Care IQ, is to connect, make it easy for patients to keep their doctors on the same page. Today, I think we manage over 155,000 patients. We've tracked or generated more than $120 million in care management reimbursements. We've collected millions of data points for physicians in 14 specialties across the country. So we've been around patient care as a patient, as a provider, as somebody inside the business, as well as on the business. Now, chronic care, as I mentioned, it goes from bad to worse in a hurry. The more you get, the more medications you take, the more volatile those conditions are, the more phone calls they're making into your practices, the more confused, the more quickly you can become kind of demotivated. But it is a huge problem, and it is almost exclusively the reason value-based care exists. Medicare knows that this has been coming. That's why they're throwing money into care management. When we started, there was one reimbursement for $42. Today, there are over 25 monthly recurring reimbursements, and some patients pay as high as $365 per patient per month. And have you ever seen Medicare reinforce reimbursements or increase reimbursements that have? I haven't. And the reason is they're trying to find something that works, and they're putting money out there to incentivize doctors to figure out, how do we keep patients well instead of treating them when they're sick? Waiting for the sick to get sicker just doesn't work. So you know all these statistics, right? 7 out of 10 deaths are due to poorly managed chronic diseases. 99% of payments that Medicare makes are on behalf of patients with chronic disease. So they're not going to stop until everybody gets this figured out. It is a worthwhile investment. When we first started enrolling patients in 2015, doctors were like, do you think they're really going to keep paying this $42? And they have. I never dreamed it would get this big, but it's getting bigger day by day. So the reason it's going to keep getting bigger is 10,000 patients a day will be turning 75 for the next 18 years. And the cost of treating chronic disease in America overall is the equivalent of 18% of everything produced in America. That's called the GDP. It's the equivalent of 18% of everything produced in America, goods and services. Almost 20% of that is around chronic disease and chronic disease management. So, and it's not that doctors don't know what to do. It's not that we don't have treatments. It's not that we don't have urgent care and pharmacies and hospitals and good practices like yours. You all know what to do. It's that we don't know when, right? Because patients that have the disease aren't living with the doctor. And so that's the bridge we set out to gap. If you would go to the next slide, please, Justin. So why is that, right? In every complex system that you have, you turn on your car, it goes through 15 different systems checks and gives you a check engine light, an ABS alert, check your airbags alert, all kinds of stuff like that. In your computer, if you're downloading a file that's corrupted, it's going to warn you, right? If you're getting low on your bank account balance, it's going to warn you. If you're getting high on your credit card balance, it's going to warn you. Some of us even have doorbells that will tell us who's at the front door. I can literally look at my phone and see who's at the front door. But if you're like me and you have a condition that has to be managed so aggressively, you have to make yourself bleed more than 25,000 times over 20 years. My doctor doesn't know what's going on unless I'm in his office or I call him. And typically when patients call their doctors, it's too late to be preemptive or to be preventative and either way, for them to do something ahead of time. Patients fall into two categories. They call way too often, or they don't call enough. And so if they're not in the office and I'm not hearing from them enough, or if I'm hearing from them so often that we're not really paying that much attention anymore, then they become invisible. And it's because you would always know what to do. You would always know whether it's, hey, you need to go to the emergency room right now, which we're trying to prevent, or let's get you into the office, let's figure something out, or maybe why don't you double up on your diuretics for today and stop taking that steroid cream for your poison ivy. So if we can illuminate a patient's status, we can engage the doctors and the clinicians with the knowledge to treat them. So that's what we set out to do, was enable doctors to have the right information to care for the patients, but also put that burden on the patients. Practices are way busier than they should be. You're required to be in the business of patient care, which needs to be your focus. You have to be in a lot of other businesses to manage it, and it almost makes it impossible. So you're going to need some help. You're going to need patients giving you the right information at the right time so that you can care for them. So we're going to talk today about how we optimize CCM and RPM. The first thing is you have to engage your patients so they're not invisible, right? And they need to know what information you need, and they need to be able to provide it to you in a fast and easy way. So the first thing about if you want to have an impact in Athena, is have a way to electronically engage those patients so they know what information to give you and when to provide it. And it is possible, right? Our average Athena practice, I think, generates over 13K a month in monthly recurring reimbursements. And patients that start with Chronic Care IQ, and probably with most engagement systems, 87% of our patients that start are still engaged a year later. So the first thing is make it easy for your patients to be visible. And that's what we do. If you want to go to the next one, Justin, thank you. All right, so that's what I mean by visibility. How do we do that? Well, a lot of times patients won't know what to tell you, right? And if you just let them talk, they're going to tell you about their granddaughter that made the swim team in Seattle, instead of that they've noticed some new swelling, around their ankles this morning. They've gained 3 pounds in the last 24 hours and they're short of breath, right? They might think, well, I'll just see how I feel tomorrow and the next day and the next day. And that's when we start to get in a little bit of trouble. So if you, the way that I haven't found anything better, to tell you the truth, is you simply ask them. And to ask to engage as many patients as you have, especially with chronic disease. I think Medicare says 69% of patients over the age of 65 have 2 or more. The way you make it easy for them to tell you the right information is you ask them relevant questions to their problem list. And we do that. So we have over 600 different clinical monitoring protocols that doctors and nurses have invented. It is a short but frequent question set. And I think our average is, I think the vast majority of ours are 2 days a week, but they're just simple questions a patient can answer. When was the last time you were dizzy, right? Have you been short of breath? Is it better or worse than it was yesterday? So asking those patients questions, or asking their children those questions, is really helpful. We do that through an app that they can download, through a text, like just text questions, hit that and answer the questions. Very simple, yes, no, check all that apply, that type of stuff. Many of our seniors use email, and that's just what they're comfortable with. And then a landline. We enable practices. We tell which member of your staff to call which patient, what time, and what questions to ask. So we make it easy to outsource that to a third party internally. And there are a lot of third-party partners that we have that use our platform to engage your patients for you, so you can completely outsource it. And devices has been the biggest thing over the last 2 years, right? Internet of Things devices. We have a whole cohort of device manufacturers. Send the patient home with a blood pressure cuff. That's important. We'll get that automatically. But if the blood pressure is going up, I want something to send a message right back that says, hey, have you taken your medication yet? If it senses that things are a little bit off. So getting that complete picture of subjective, objective data and automating it. You can't do, you want to do more work for your patients, but you can't do more just, I hate to use the word, we call it like, it's like grunt work, where you're just kind of, it's brute force. You can automate these things so it's not brute force. We want your clinical intelligence. We don't need brute force. So you want to get something that's going to automate. So can we go to the next slide, Justin? So the way we do that is we ask all those questions and then we look at the responses. Now we've got 10 years, 600 monitoring protocols, millions and millions of data sets. And we can tell if a patient is approaching risk. It's not perfect, but it does say, hey, this patient looks a lot different today than they looked yesterday. This patient has exceeded a clinical threshold. This patient's trending in the wrong direction for too long, or this patient just started trending in the wrong direction, or hey, we haven't heard from this patient. So all of that's automated. So you're not picking up the phone and calling, or texting a patient. Your staff simply they've got to do much more work, much smarter. And that's what this allows us to do by having those protocols that engage patients and you having them. There are other systems out there in the marketplace that do some of this. I don't think any of them do as much as we do. But you already know what to do when you see red, yellow on a dashboard with patients. You're going to click on the red, you're going to click on the yellows, and you're going to find out there is something going on here but mostly, do they need me right now or not? Do I need to pick up the phone and call this patient? Is there something I can do? And instead of waiting until they call and they're very short of breath, they've got swelling all the way up to their knees and now some around their midsection. They slept with 4 pillows last night and they're too tired to get out of bed. You're going to get alerted when exacerbation decompensation just gets started. So everything from the usual suspects like hypertension to orphan diseases, we have protocols for, and you get a jump start on their care. That streamlines operations in the back of the house with the nurses and the MAs. You're dealing with patients while they're easier to manage than when they're harder to manage. But this is really situational awareness of my at-risk cohort and who needs me now. So that's the big thing that I always say, like, if you're going to do value-based care reimbursements, you're going to participate in care management, you've got to let the patients help. And they can help you by answering questions that will give you this exception list of the people that you need to get in front of. Thank you, Justin. So, and as I mentioned, it is meaningful revenue, and it can either not make very much revenue or it can make a lot of revenue. And there's two important things, and I want to go back to automation. The reimbursements, the vast majority of the reimbursements are based on time. It's the amount of time that your physicians and clinical staff, so medical assistants, people doing care coordination, et cetera, it's the amount of time that staff spend on non-face-to-face clinical activities. Medication refills, reviewing lab results, charting, pajama time the night before a visit, coordinating care with a cardiologist, trying to get that patient in for a scan somewhere. All of the things that good chronic care requires already are reimbursed. So you already have a head start to these reimbursements. You're just not tracking that time. Or if you're doing care management, I want to say that one of the biggest things you want to do is to be able to automate that time capture. So a huge piece of this for our Athena practices, when you're doing activities like that in the chart, we track it to see if the patient has had an appointment that day, so we know if it's non-face-to-face or not. And then we timestamp it and we drop it into the audit log. So by capturing the work that you're already performing, it reduces the amount of additional time that you need to perform to get to a billing threshold. The first billing threshold is 20 minutes and it pays $64. And you can't monetize 20-minute increments perfectly into an hourly rate, but if you could, it's $192 an hour. And if you annualize that revenue, that would be almost $400,000 a year. That's how much Medicare is paying to keep patients out of the hospital, right? So the trick becomes, how do I capture that work without having to pick each 2 minutes and each 3 minutes and 33 seconds up individually? And that's where automation comes from. So first we have to engage our patients. The second is we have to automate where the time is coming from. So ChronicCareIQ plugs into Athena, pulls that time out. It also engages the patients and pulls their data over to a dashboard. So when you're looking at a dashboard and you're seeing who's red, yellow, and green, you are effectively monitoring all those patients on that dashboard. Medicare says and published that is a care management activity. So looking at the dashboard is a care management activity. And that generates 30 seconds a day, which generates 10 minutes a month. So now not only are you finding out who do I need to care for, how do I need to reach them, you're also plugging into the EHR where things are happening. Where does most non-face-to-face time take place? Can you guess? If you could, I bet you would say it's either in the chart or on the phone or both. So ChronicCareIQ is a bit unique. We plug into phone systems. So essentially we scrub the caller ID log, we throw out the non-clinical extensions, we throw out the hold time. And if you're on the phone with a patient, you're obviously non-face-to-face. Anything that needs to be documented about that call when the patient calls you still goes into Athena. We're just pulling that time in. And we can also tell if you're in the chart at the same time you're in Chronic Care IQ, so none of it overlaps. So now you're getting a really robust summary of all your time. You're getting protected to make sure none of that time overlaps, but you're also protecting your own finances because you're capturing all the time. I think we talk about reimbursement too much, but it is a problem in medical practices. It really is. Like I said, you're in too many businesses to be in the business of healthcare. So this gets you out of the time tracking business of 20 patients for 20 minutes a month, at least 20 minutes a month, for 200 or 300 patients. That could be 2 or 3 full-time people's job. You can't have more full-time people's job. You have to automate it. The average per patient per month reimbursement is over $103, and the average per provider per month, Athena per provider per month reimbursement, I think it's over $13,500. It's extraordinary, but when you see it, you'll believe it. Okay, I feel like I'm rambling. Justin, if I'm talking too much, push me forward. You engaging patients, right? You're making complex patients easier to care for. So clinical folks on the phone, you would much rather plug into a heart failure patient before they're overloaded, right? And before they're really pushing their ejection fraction. You know that if you can reach a type 2 diabetic when their blood pressure and their blood sugar goes up, rather than having them be over 250 fasting blood glucose, 300, 320 for several weeks in a row, we can start to get those numbers back in the right place. You'll also know that's a very gentle way to remind the patient to care for themselves. You don't have to tell them to do this, do that. Just answering those questions, it will keep their own health on their mindset. We have shown, right? It was an independent physician. His name is Dr. Randy Durbin, presented at the American College of Cardiology in March 2022. Like literally, COVID was just getting started. They were telling us to put a mask on when we got on the plane to go home. Presented independent data, 3 years from Ascension, showed a 29.4% reduction in all-cause hospitalization. So it's a chronic care IQ cohort of patients versus matched non-chronic care. So getting patients involved earlier, they're sticky, they love it. It has a definitive clinical effect on keeping them well, and it generates a lot of revenue. The one that surprised me the most, it was never that patients would be sticky. I was the scared guy. I was the one like, well, what the heck happens now? I'm like 30 years old and I got to poke holes in myself. I was still single. I was afraid to tell girls I had diabetes. But one that did kind of surprise me, and we hear it all the time now, is increased referrals. I never expected that. I never even suspected that, but we hear that from administration because I have been a caregiver to my parents. They talk about medicine all the time. They talk about and so a good system will help you with that, because providing that higher level of care, it's not only easier for your practice, but patients feel better about it too. I probably talked way too long. I can talk about it till it gets dark if anybody wants to call me. I love the problem because I love the way we fix it, and I live with it every day. So somebody else should go next.
Yep, nope,
I think
Fahad,
I'm
you're up, my
next.
friend. Thank you.
Thanks, Matt. That was great. So hi, everyone. My name is Fahad. I oversee our operations side of the business here at Chronic Care IQ, which includes customer success. So a lot of implementation, training, account management, those types of activities fall under my sort of supervision. And I wanted to talk a little bit about today of how we technically and operationally make this happen between CCIQ and Athena specifically, so you all can see exactly how the integration works, exactly which fields we pass back and forth, and exactly what the benefit of us passing those fields or those points of data back and forth between the two systems is, and how making that available to you technically speaking through an integration helps you operationally. Whether it's internally operational for your organization, or with your patient engagement and things like that. So we'll sort of talk about all of that briefly. We'll go to next slide. So this is a high-level overview of how this integration technically works between Athena and CCIQ. We call this a bidirectional interface, meaning data flows both ways, right? The beauty of it is that you never have to log into CCIQ. When you're logged into Athena, you're doing your day-to-day activities inside the EHR. From within the EHR, you can click a button, and through what's called single sign-on, you're able to access the patient's chart within CCIQ. So there's no need to remember different sets of credentials, usernames, passwords, anything like that. All of that is built in the system for you. The data, when it comes to what is it that we share between the both systems, coming from Athena, unidirectionally from Athena, what comes over are essentially 4 different categories. Within these categories is a lot of different other stuff that comes over, but high level demographics. So anything you need to know about the particular patient's name, gender, date of birth, address, phone number, email address, things like that. That data comes over. An important piece of that comes over is the diagnosis or the diagnoses that come over, and I'll talk about why that's important in a second. Clinical data, like Matt was talking about, prescription refills, lab report reviews, imaging report reviews, actual care management work that is happening, and that coming over, so we have a record of it. Care plan stuff. So essentially, we get the CCDAs come over from Athena into CCIQ, from which we generate the care plan inside of CCIQ for you. If you wish to document the care plan in CCIQ, a lot of people do it in the EHR, some people do it in CCIQ. It's a preference by organization, by provider. And then providers information. So, if you are an organization that's always growing, adding providers, removing providers, and it's a constant type of thing, you don't have to manually worry about it. The integration will take care of that for you as well. Going back, so information going from CCIQ into Athena includes comments. So any type of comment that you put in CCIQ in the patient's chart will actually have a record associated with it in Athena under the clinical notes section. Claims data, so all the charges that get created that Matt was talking about, the 25 plus different CPT codes that we have, all of those that get created gets pushed over to Athena as well. And then lastly is the audit log. So a monthly audit log essentially is a record of all the different activities down to the second level, gets documented in the CCIQ audit log that we actually push out to Athena once a month as well. So that's high level how technically the integration works. And in the next slide, I'll talk a little bit about the benefits of why this integration is important. So I talked about how robust the Athena CCIQ integration is, right? Essentially, anything that you do in Athena or CCIQ, we make sure that that data, those points of information get communicated between the two systems, technically speaking. Talked a little bit about single sign-on, meaning the ease of use. You can log into one system, you can access both. Streamlining patient enrollment and care management workflow. So this is where the bulk of sort of a lot of the benefit that I'll kind of focus on and talk about. So you all heard us talk about the demographics information coming over from Athena into CCIQ. Well, it's important to have that information up to date in both systems, but what does it really do for you, right? What is the benefit of it for you as an organization? The thing that it really helps with is patient enrollment. When it comes to care management, remote patient monitoring, different care management programs, one of the biggest things that people want additional help with is enrolling patients, or complementing, whatever the organization is doing from enrollment perspective with some type of data or strategies. So what we do here is as all that information comes in, the demographics information, and it includes diagnosis codes, it includes, the patient's age, whether the patient's alive, their insurance information. Based on all of that data, we have algorithms built in the system, and we will tell you which patients you should go after enrolling into your program based on the severity of their diagnoses or their age or their risk level. So with a click of a button, you'll get a file, and in that file, it'll include all the patients from, if you have 100 patients, it'll sort it for you 1 to 100, which ones are the ones that you should enroll into a care management program first. So that's the beauty of that part of it. So it really helps a customer or a provider organization come up with strategies on how to enroll patients. Then once you have that information, what do you do with it, right? How do you actually go in and enroll those patients? Well, a natural way and the most effective way is for the provider to have a conversation while the patient's in the exam room with them, to enroll them or to talk to them about a care management program and enroll them into that program, right? That has to be the most effective way of doing it. How can we, through technology, enroll patients into the program as well? So what we have in our system in CCIQ is called campaigns. Campaigns essentially is a medium for you all to be able to enroll patients. So that file that I was talking about just about 30 seconds ago, where we tell you exactly which patients to enroll, you can take that list of file or that list of patients and create a campaign from within CCIQ that will make an outreach out to those patients for you, telling them or educating them about their program. And if those patients are now interested in talking to somebody about the program, they can say, yes, I'm interested, or yes, I want to enroll. And somebody can actually give them a call and start talking to them about consenting them and starting the monitoring sort of process. So we not just identify or help you identify the patients that need to be enrolled into the programs, but we also give you a method or a medium for you all to enroll those patients through. I'll speed it up here. I know we only have 5 minutes left. The clinical data points, I'm not going to talk about that too much. We already talked about it: prescription, lab reports, and imaging reports that actually get sent into CCIQ, converts it into time activities, which converts into CPT codes, right? So essentially all of that, the interface essentially helps with doing all that work, and nobody really has to manually do any of that. Lastly is the phone system integration. So, Matt talked about that for a little bit. The piece that I'll talk about there is when the phone system is integrated and a staff member is talking to a patient that is actually enrolled into one of the programs, is great, right? All that time is being captured. However, one thing I'll sort of point out is the patients that are not active, what we call in CCIQ are unclaimed patients, meaning that nobody has yet enrolled that particular patient into a CCM or RPM or any other type of program. If you are, as an organization, one of your staff members actually talking to one of those inactive or unclaimed patient, our system will capture that as well. So if you see a big trend in that, so say, for example, if you're talking to 50 patients every single month for more than 10 minutes, and they're not actively enrolled into your program, that may mean that you actually should start to work with those patients to enroll them to the program, because you're actually talking to them already pretty significant with a significant amount of time. The last couple of things I'll talk about, patient engagement, disease-based sort of proprietary protocols that we have built in CCIQ that will help engage your patients for you through our system. Matt talked about that, so I won't dig into that too much, but that is the reason we have that high patient engagement score that we were alluding to earlier. Some of the other benefits, the one of the biggest benefits of the platform, once everything is integrated and everything starts to work and you start to monitor your patients into your program, is the dashboard or the monitoring, what we call a monitoring dashboard, where you saw snippets of it in the slide that Matt was showing. But essentially, if a patient is red, yellow, green, and then what do you need to do actually to reach out to them in order to resolve any particular issue to keep that patient out of the hospital, or making sure that the patient's life is not in danger or in threat. We'll go on to the next slide. I won't talk about every single one of them here, but one of the biggest ones that is at the top, that is the most prominent, is a provider that is using CCIQ and is on Athena and is taking advantage of our platform as well as the integration that we have with Athena, generates on average over $13,000 per provider per month. So that's, I would say, it's probably the highlight. The other numbers are also great, with 73% actual billability. So 73% of your patients actually become billable. Average productivity, so a staff member's average sort of productivity, about $86 an hour. And on average, we see each organization enroll at least 25 patients per month into 25 new patients per month into their program. And I think the next slide is the last one. So you heard us all talk about the benefits of CCIQ care management programs, the benefits of Athena's integration with CCIQ. We'd like to show you and actually have you all take a look at a provider down a little outside of Dallas, Texas, who is currently using Athena and CCIQ together, and the benefits of the program that it has had on their patient and their community. So don't just hear from us. Go into take a look at that case study, and take a look at what Dr. Seiger has to say as well.
Great success there. So I think, yeah, thank you very much, Fahad. Thank you very much, Matt. We've got plenty of time here, so we can take some time for questions. Let me go over here and I'll kind of pull them up in order in which they were asked. So number one, how does CCIQ integrate value-based care? So I've got my thoughts, but as a CEO of the company, Matt, what were some of your initial thoughts there?
You think in terms of value-based care much more than I do. I've been around medicine and technology, and so many terms get overused. But value-based care, I mean, the net of it is how do we keep patients healthier, and focus on that versus waiting until they're sick, right? Waiting until people show up. So the way that we do that is we get involved earlier. If you think about, in simple terms, in healthcare, we spend a lot of time, energy, and resources changing the engine because we didn't change the oil. So if you think about your car, you like what, every 3 months, every 5,000 miles, we get the oil changed so it can continue being healthy. And that's probably the easiest analysis that I have for that. If we have patients that are sick, we have to be engaged before they get sicker or when they start to get sicker so that we can help them remain healthier. We don't bounce back once you're 67, 68 and you have an adverse event. It's a little harder to come back.
Very true. So what I would add there is a great point, Matt. So where CCIQ supports value-based care specifically, there's a couple of different areas. First of all, the metrics that we have to track to on value-based care, and again, this depends on the payer, but at a high level, everybody within earshot of me now, and this is what I do a little bit of a public speaking tour on now, is every provider in the country should be at least asking their payers, what value-based care, what risk-based contracts are available to me today, or are being offered into my community, or might be available next year. So those types of questions are going to get you kind of in that mainstream of where the future of healthcare is evolving in your community. Just because it's not available to you today, it may be offered to your community, it may be offered to your competitors. So it's really important to understand what are you kind of competing against, because what this brings is, these types of contracts, and I'm not saying go full risk. I'm not talking about that. I'm just saying, hey, there are pockets of your patients, pockets of your population. It might be 20 patients. It might be 100 patients. It might be 200 patients. It might be 500 patients that you might get additional reimbursement, and you probably will get additional reimbursement if you tend to track them and manage them, like Matt was saying. You intervene earlier. The odds are you'll keep 66% of them out of the ER or presenting themselves into the ER within a year by managing them on chronic care management. So it's proven to reduce hospitalizations. It's proven to basically insert before adverse events happen. So an alert before adverse events happen. All these types of things are the kind of the strategies behind why the care management is so important for value-based care, and why payers of all shapes and sizes incentivize risk-based contracts. They incentivize providers to go this to market without any downside. You can absolutely do, downside risk as well, which have a much higher upside, but I don't even recommend that. There's plenty of programs out there that you can research that are available to you in your community, or could be available or will be available in your community. Again, this might be in 2024, but certainly in 2025, it gets you part of that information stream. You want to know, what are you competing against in your industry, and certainly with other practices or organizations in your community, because it's absolutely coming to all of our communities. It's here in most of our communities, but many of us don't know about it if we don't ask. And again, there's very low, easy steps that you can take to just dip your toe in these waters. And again, a CCM program is a great first step, but value-based care is the eventual, that is the future of healthcare. How fast we get there, that's all up for debate. But if you can begin moving this direction over the next 12 to 18, 24 months, you'll be perfectly positioned to where healthcare is going to be in 5 years, 10 years down the road. So that's where I'd leave it there, just for the sake of time. Next question. There are quite a few CCM RPM players in the market. What makes CCIQ different? Matt, 30 seconds to give that to you.
Yeah, so the biggest, number one, we've been doing it longer than anybody else. We're more comprehensive. We engage more systems, and we automate more. Right. So there's some people that plug into device codes. There's some people that ask patients questions. And then there are some that say, hey, we'll call your patients for you. I believe that this is a higher level of patient care that practices can do themselves, which is why we built it. It's robust. It's proven. Look at the result. Look at what the practices say. We are very, very millions of data points, hundreds of millions of dollars in revenue. I just think we do it very well. We're patient,
much more optimized. Absolutely. Yep. Fahad, anything you want to add to that?
No, I think, you guys covered it pretty well. I think one thing I will highlight that, I mentioned it a little bit in my slides, but the patient enrollment piece. Mm-hmm. So, we hear from our customers on a regular basis of how much they struggle with patient enrollment, and how much what we provide as part of our platform and our product, the technology, to make it a little bit easier and take that burden off.
Switch to us.
That's a big reason why they switch to us. Yeah. So solving problems like that through technology makes us extremely difficult. And then, I don't want to keep going back to it, but the dashboard approach that we take, and the risk stratification that we do for your patient, where somebody doesn't actually have to do that work manually, or take a bunch of data and hire somebody to analyze that data for them. The system does that for you in real time. Right. So a clinician, a provider, an end user, anybody can log into the system and see the red, yellow, greens, and how healthy your patient population is or can be.
That's a great point. Next question, will the slides be available? Absolutely. We'll be showing these slides out. Also, an ebook will be coming to you as well that kind of summarizes this entire event. Next question, how long does it take for the Athena interface to go live? Fahad, why don't you take that one?
Yeah, please? It's a great question. So it's real time. It's with a flip of a switch is what we say typically. But the Athena interface between Athena and CCIQ is what we call an API-based integration. So it's near real-time integration. All the data that is shared between the two systems near real time, but the integration setup is a flip of a switch. We've already done all the work. We're just onboarding customers onto it. So yeah, we click one button.
Yep. Excellent. Great answer. All right. Last question. We have a couple extra seconds. So if there's any other questions, please feel free to put them in the Q&A section here. Is payment for CCIQ charged based on number of enrollees, a fixed monthly payment amount, et cetera? What is the break-even number of patients enrolled in order for there to be an ROI? Matt, that's a great question. We're talking
that
about
is
ROI.
my favorite question. So
yeah.
Ross Peterson gets the best question award. I get beaten up for this all the time. We charge one low flat monthly fee, right? So many competitors, they will like say, well, we'll take half of your reimbursement, or we'll charge you $20 per patient. We charge $500 per doctor per month, whether you enroll 10 patients or 1,000 patients. And you saw that ridiculous ROI earlier, like 4,200. I went to business school. I know what that is. We're patient driven. This is something that every practice that treats chronic patients should be able to give them. I have been that guy, scared, alone. I've been next to my parents, just worried and being overwhelmed with healthcare. It's a higher level of care. We all deserve it. There's a guy named Dr. Banting that invented insulin that saved my life. He forewent his patents so that they could help patients. It made it a game changer. So we cover our costs, and we haven't raised our fees in 10 years. It's $500 per patient per month. The average reimbursement, no kidding, 5 patients will pay for that.
Yep.
And the average, so you don't want to overwhelm your nurses, because there is some work, right? Somebody's got to look at the reds and yellows and follow up with them, and you get a little bit more information. But a nurse you can add 50 patients into a practice with existing staff without having your nurses break a sweat, because it reduces the complexities of your complex patient care on the back end. You win more time by that. But there's a very robust ROI, and if you try it out and you don't get one, you can ask for me, and we'll fix it, or I'll give you your money back.
I do want to clarify. You said it's $500 per provider per month. You actually said you intersected patient in there a little bit too quickly.
Oh God, no,
provider
per provider.
Yeah, $500 per provider per month. So yeah, ROI.
You're gonna have to fix that if you recorded this. That's awful.
No, we're good. But you said it's 5 patients. You're moving into the sentence. It's 5 patients pays for the system, and I think average panel that you guys have is well over 300 patients on a panel or so. I mean, Fahad, you probably have those numbers better than I do, but it's pretty strong. So
it's
phenomenal
so
ROI.
good. I mean, patients wouldn't refer each other, and practices wouldn't see per patient increases if it didn't work. And go to the Google Play Store. So if you're like looking up an app, how many of you know people of the age 65 or older that have ever gone online and rated an app in the Google Play Store? You will see hundreds of people. They like it that much. So go analyze, go look at the reviews. Hundreds of people, they not only just said, hey, you're 5 stars, but they said, oh, I really like this. The fact is, patients will engage if you make it easy for them, right? We get a lot of, they don't take their medication, or they get out of the hospital, they jump in their car, drive to McDonald's, and have a smoke on the way. It's not the case, right? We all want to be healthy, and if it were just easy, we would do it, and we make it easy, and you'll make it easy. I want everyone to do this.
Absolutely. It's the right thing for the right care at the right time. So Matt, Fahad, thank you very much. Truly appreciate everybody taking the time out of your schedules to join us, and look for the follow-up emails. Again, we'll be sharing this webinar, the ebook, and all this information will be followed up with you over the next 24 hours or so. Thanks again. Have a great rest of your day.
Thank you.
Thank you.
Bye.